right now I do procedures for women who have abnormal mammograms, who need biopsy. And the women are so scared. If you have somebody in front of you who's that scared, the team around gets scared too.
Right.
But if you start to do a hypnosis for that patient, everybody relaxes. And suddenly it's just an entirely different sound level in the room, and things just go smoothly. So, yes, I think every time we give patients a hypnosis, we relax ourselves too. The very first application was this young man. I still remember him very well. And he was very frightened. So in a hypnotic state, we also asked him what he is, or what he's experiencing. And he felt that this procedure for him was as if he were a big piece of red meat with a knife all the way through, which is quite frightening.
Yeah.
So we worked on that imagery, or at least the staff person, I didn't do that yet at the time,
Right.
changed that into something much more manageable by, see, I remember that, 13 years later, by pulling the knife back, making it a plastic knife, having the meat become not red but more black and white.
Changing the color, sure.
Moving it away, and then basically placing the patient in control, overviewing this image, and then going into a state of resourceful relaxation. And that was very powerful.
Yeah.
And whenever he came back, it worked much easier. And that's something we've seen in our research now too. If patients learn this once, they really can do it on their own the next time.
I see.
Because if it has to, you can learn this very fast in that setting. But then I thought, this is really neat, but let's test it. And so we designed the first study, which was actually funded by the Department of Veterans Affairs. So they were very foresightful. We've just completed a study which is being published where we actually showed that they have less pain and less anxiety than under standard care conditions. So I take that as one indicator that it works.
How do your colleagues respond to you as a doc who brings hypnosis into the mainstream medical workplace?
Well, in the beginning, I had a lot of ridicule.
Ridicule, yeah.
But it's changing. And what is so funny about it is that some of the people who are a bit skeptical, when they have their own surgeries, they ask to help out.
What's your vision of the next 5 years here as far as mainstreaming and growth of the field?
The data are out, just as you said. And we've actually had a request from a very large imaging center, private imaging center, to actually train the personnel. And I can see that once they will do that, it will be a competitive advantage. And then probably others will ask for it too. But I thought it was very fascinating that this request actually came from a for-profit operation. Because they've realized, you know, if you do 100 MR scans a day and 5 patients are claustrophobic and can't do it, you just can't cut that in half, you do much, much better.